Alrighty then. So I want to talk a little bit about healthcare and your mental state and awareness. Now, when I first got sick, and they gave me a year to live, it was devastating. I mean, my whole world crashed. And it's hard. It is so hard. I mean, if you ever need to reach out, just try to send me a message through here or through the Facebook page, Mixed in Motivations. But right now, I am on the way to go get my medicines. Now, drug companies, the huge ones, such as CVS, and CVS is the worst, and Publix, and Walgreens, those places are very strict about the medications that we'll give you. In order to function properly and be a happy person, I have to take a lot. So I'm gonna tell you everything I take, and don't freak out. I'm not a druggie, but I just want to make everybody aware, or people aware, that it's okay to take medication for your mental health, because really you need it after being diagnosed with something so debilitating and life-changing. And the reason I go to Brunswick is because the pharmacy there's a small pharmacy, and I only have to go once a month, and they fill all my prescriptions, and they don't judge me, they don't ask questions, they don't deny me, because it's up to the pharmacist really whether they're going to give you the medication or not. It doesn't matter what your doctor says. Even if they write you a script for it, doesn't mean they're going to give it to you. That's why it's important to find a good pharmacy that is willing to work with you, that understands your history, and a good person to ask would be your psychiatrist, which I highly recommend you go see one. So right now, I'm on Prozac, 40 milligrams, twice a day. And then I have Xanax. And then I also have Klonopin. The Xanax helps with the anxiety, which I don't really take it during the day because it makes me tired. I take it at night, or unless I'm having a really, really, really bad, stressful day, I'll take it then. And then the Klonopin helps you sleep through the night. Eventually your body gets adjusted and gets used to all that medicine, so it's good to take a break every now and then if you have time to just stay up all night, can't sleep, and do something. But just to break the cycle, so that way you don't get, number one, like hooked on it, and number two, your body doesn't get so used to it that it doesn't help anymore. So those are some of them that I'm taking. I'm not done. I also take erlotinib, or Tarceva, which is for the mutation that I have. It's EGFR mutation, a deletion of exon 21, I think. Maybe 19, I can't remember. So, I have a specific therapy that is targeted towards me where I take a pill a day. Now, a lot of people think, oh, you only take a pill a day, that's easy peasy, lemon breezy. It's not. Because the side effects that come along with it are painful. And getting anything for pain when you have cancer is absurd. So my pharmacy will feel it, but I have started learning to just live with pain, because I have been accused by not only friends but family, and I'm not going to name names, but I've been accused of being a pill popper. And for 12 years, when you are accused of being addicted to some kind of medicine, such as pain medicine, it's not even worth. I would rather go through the pain than be so upset every time someone says that to me, because they do it a lot. And it's a trigger for me. Actually, it has become a trigger ever since I started going to the doctor for my rotator cuff. I mean, I survived 12 years and, you know, occasionally got pain medicine, but I couldn't do it anymore because I don't need it. Well, I do need it because of the side effects, but you have to build up a high pain tolerance. So, alright, I'm off track again because I'm so ADHD. So, I also take, since my medications make me tired, I take a blood thinner, which is Eliquis, and I also take Adderall. And the Adderall keeps me awake. If it weren't for the Adderall, I would sleep all day long. I mean, I was in the middle of conversations and I was falling asleep in the middle of talking. So, let's see here. Eliquis, and then I take gabapentin, and that's for, I had restless leg syndrome. And I take a baby aspirin every morning. So those are the medications I take. And it takes a while sometimes to find the right medication that will make you feel okay. It took 3 different medications for me to find the right kind of antidepressant. And I did. But it was hell trying to find it, because when you're going through trying to find these medications, you have to take them and they have to get into your system, and it takes a while, you know, like a good month or something. So you take them, you get the side effects from them, and then you realize, I can't take this. I've taken some that make me want to peel my skin off, and some that made me cry all the time, even more depressed. And it's different for everyone. So, like, you know, you have to try it out and you have to give it time. So it was probably 3 months in to my diagnosis that I actually got on a good antidepressant for me. And Prozac is what worked for me. Now, or fluoxetine. Without it, I thought I could go without it before. No. Without it, I cry all day, all the time. So, I always have to make sure that I have those filled. And I always have to make sure I have my Eliquis filled because of the strokes that I've had. I've had 5 strokes, maybe 6. I think I had one last week. And it was a mini stroke, but my hand goes numb, and that's like the first sign. I only had one really big one. That was in 2020, of course, in the middle of COVID. I had a stroke where I lost all the ability to walk everything on my left side was paralyzed. And I went to Baptist in Jacksonville, and I had people tell me that, you know, people don't usually recover from this kind of stroke, and, you know, you You might have to use a walker. And me, I was like, screw that. I have a daughter, and she was a sophomore in high school, I think. Yeah, it was her sophomore year, because I didn't go to many volleyball games. And I was thinking, I am not going to be that parent that walks in with a walker or in a wheelchair or something like that, when I could go through rehab and build up the strength and have the opportunity to walk again and do everything normal again. Because if you had that opportunity and you have that chance, take it, do it, push through it. It's hard. You'll cry. It's emotional. It's painful. But just do it, because it's so worth it. So that's it on medications. And when I went and had my rotator cuff surgery, which is probably from me moving so many times in the past 2 years since Carly went to school, I tore my rotator cuff, and my bicep was like completely off or something. It's very important to go to the rehab, because the rehab will get you through. It was my right shoulder. I still have scars, because I don't care about scars anymore. I've gotten over that. I have scars on my head, I have scars on my arm, I have scars on my legs. It doesn't matter. I don't care. All I care about is that I am still here by the grace of God, and I am still here for my daughter. And that's all that I could ask for. So when they prescribe you medications at the doctor, there is a reason, and you need to take them. Now, if you have side effects, speak up. You cannot survive cancer without being hard. You have to advocate for yourself. You have to research for yourself. You have to look up what may work and what may not work, and you have to suggest it to your doctors, your oncologists, pulmonologists, psychiatrists, orthopedic surgeons, whoever. But you have to demand. I didn't demand, and my headaches continued, and I got to the point where I almost died. I was a few days away from dying, because the tumor had shifted in my brain so much that I couldn't even see anymore. And by the grace of God, I was in Atlanta, and it was over Thanksgiving, and I was with my dad, and I still have his clock, even though he's passed away. I still have the clock, because I remember the ticking of the clock, and it was hurting my head so bad. And I was thinking, there has to be something wrong with me. Nobody was giving me any scans. So I encourage you, and I'm going to encourage you in every video, to take control of your health care. If you don't feel comfortable with your oncologist or anybody else, get another opinion, go somewhere else. That's the key to survival. That and God, for me. Any other people may be different, but for me, I give it to God. So that's it on pharmaceuticals. Now we're about to get into side effects and how painful they are, and what the doctors have told me to do about them, even dermatologists.